our group was interested in looking at the effects spending has on the health of nations' populations. We looked at two graphs which depicted how government spending per capita correlated with life expectancy at birth for many countries. In order to investigate this idea further, we went to Gapminder to examine additional trends. The first two trends of data which we compared were national health spending, which is described as the average health expenditure per person, versus the child mortality rate of that country. The child mortality rate is explained as the deaths of children under 5 years of age per 1,000 live births. This data showed a strong negative correlation between government spending and child mortality, which we expected. Certain countries, such as Turkey and Italy, exemplified this trend well. As they spend more on health, their child mortality rates decreased. It is also worth noting that certain countries experienced fewer child deaths with varying spending trends, which can be attributed to better technology and better care in nations such as Argentina, even though they experienced riots and economic depression around 2001. Certain countries have also experienced increasing and decreasing child mortality rates over the past 20 years. South Africa, for example, saw decreases in total health spending and increases in child mortality rates as a result of HIV-related birth infections. While South Africa experiences malnutrition and other problems that are common amongst similar nations, South Africa does have significantly higher rates of HIV and related diseases, contributing to the child mortality rates, especially in the late 90s. The Gapminder data showed that spending on health helped decrease child mortality, but it did not explain what spending on health looked like and why this correlation exists. Due to Gapminder not having any more information on government health spending, we looked to the World Health Organization for answers. A report written in 2009 titled A Call for Engagement for Maternal, Newborn, and Child Survival outlines how basic needs such as sanitation, food, and water will help developing countries, but a vital need which would greatly decrease infant and mother mortality rates, is doctors which can perform C-section operations and correctly care for mothers and newborns. This report also suggested many organizations, such as the Partnership for Maternal, Newborn, and Child Health, who are partnering with the World Health Organization to try to aid countries in need. This report prompted us to try a different set of data in Gapminder. We looked at the relationship between the number of medical doctors a country had per 1,000 people versus child mortality, and saw that if a country has fewer than one medical doctor per 1,000 people, there was a strong positive correlation to child mortality. This information showed that areas such as Africa and South America, which had very few doctors, and also much higher rates of child mortality. By examining the data from 2000 to 2016, we saw a general movement of almost all the countries to the left and top of the page, which suggests that as countries develop and gain more doctors, they are also decreasing the rates of child mortality.
The report also indicated that access to basic resources helps decrease child mortality, so we decided to look into this by examining access to basic sanitation. When examining the effects of access to basic sanitation on child mortality, there was a strong negative correlation between the two variables. As expected, nations that had a higher percentage of their population with access to basic sanitation tended to have much lower rates of child mortality than those with a lower percentage of people with access to basic sanitation. The United States is in an interesting situation with their health spending. Although the U.S. has the highest average health spending per person at $8,360 per year, the child mortality rate of 7.3 per 1,000 is behind a majority of European nations who spend far less on average. Much of this can be explained by factors outside of quality of care. The combination of private and public money in American healthcare increases spending exponentially, along with racial issues that have kept the U.S. away from the best of the best. The average infant mortality rate of black children under the age of 1 was 7.57 per 1,000, according to a 2015 Health in Place study. The mean of 7.57 for black children under the age of 1 exceeds the mean for white children under the age of 1, which is 3.31 per 1,000. An additional trend we found on Gapminder that supported the idea that a nation's government spending on healthcare has a direct impact on the well-being of its people was the relationship between the proportion of total health expenditures that has been paid directly out of pocket by individuals versus child mortality. As expected, there was a strong positive correlation between these two variables. Nations such as Sierra Leone and Ivory Coast, whose percentage of out-of-pocket spending is far higher than most other nations, tend to have the highest rates of child mortality for children from ages 0 to 5. With such a small percentage of health expenditures covered by the government in many of these nations, families often don't have the kind of money required to bear the expensive costs of treatments and procedures for their children. There are several outliers, such as Singapore, whose out-of-pocket spending accounts for about 38.4% of health spending, yet still have a relatively low rate of child mortality in comparison to other nations. This, however, can mostly be attributed to the fact that the government in Singapore pays for most of the medical system itself, including hospitals. While the relationship between the percentage of healthcare spending that is covered by the government and child mortality has a strong negative correlation, it still can't be proven that it is a causal relationship. While it appears that government spending on healthcare has a strong effect on the well-being of its people, there are still many other factors that account for the overall health of a nation's people.